High blood pressure, or hypertension, is one of the top health problems in Canada. According to the Public Health Agency, it affects about 1 in 5 adults. Carol Bruce was one of those statistics. She was diagnosed with hypertension in her 30s. A routine checkup revealed hypertension, putting her at greater risk for heart disease and stroke.
I was very surprised because at that time I was quite young and I had no risk factors whatsoever. So it was a complete shock to me. The reading was around 150/100, and I was surprised and a bit scared because I had no idea.
Hypertension Canada wants to make sure that we have our blood pressures lower than 140/90, but we need not be starting medication until our blood pressures are 160/90 or above. That means that lifestyle changes are important. Weight loss, increasing activity, watching the salt in our diet, in addition to medications where appropriate. If you have other health issues, however, such as diabetes, your doctor may be aiming for a lower blood pressure.
Dr. Beth Abramson is the director of the Cardiac Prevention Centre and Women's Cardiovascular Health at St. Michael's Hospital in Toronto.
High blood pressure or hypertension puts you at risk for heart attack and stroke. It's the silent killer. You can't feel your blood pressure, and there is an epidemic of hypertension amongst Canadians. Women need to be aware also that they are at even greater risk for stroke with high blood pressure.
Working together with your doctor to manage high blood pressure is important to reducing the risk for heart disease and stroke. One way to do that, says Abramson, is to check your blood pressure on a regular basis using a home monitor.
A home blood pressure monitor is very useful for many of my patients because it helps reinforce the fact that we are responsible for our own health. It allows my patients to know their numbers, be proactive, and take charge of their health.
Knowing my blood pressure is very important because I need to know, I need to keep track of the readings just to make sure that everything is still okay. These days, my blood pressure is it's very good. It's around 110/70. If I notice it's high, I do get concerned. I tend to try to keep track of it and then discuss it with my doctor.
Dr. Abramson explains that it's important for patients to measure their blood pressure frequently enough so that they know their numbers, and home monitoring can help achieve that goal.
Having a home blood pressure monitor will allow a patient to know when their blood pressure is just creeping up a bit too much. Usually it makes patients more compliant with medications, and it gives people motivation to continue with lifestyle changes.
When I first got my blood pressure monitor, I was checking my blood pressure every day because I had just been diagnosed. But since it's under control with medication, I only need to check it once a week or so just to make sure that everything's where it should be.
Most home blood pressure monitors are easy to use, and many offer special features to help you manage your blood pressure more effectively.
It gives me as a physician a good snapshot about what's going on within their lives, not just in the doctor's office. When my patients use home blood pressure monitors, I know that they're more likely to reduce their risk of future heart attack, stroke, and damage such as kidney damage. It's also really important that if you're using a home blood pressure monitor and your numbers are a little off, come in and talk to your doctor. I see that patients get better control in a faster period of time by using a home blood pressure monitor.
When monitoring your blood pressure at home, it's important to use a clinically validated monitor, like those from Omron Healthcare.
The home monitor needs to be of good quality, and it's important that a patient gets a machine that's validated and accurate. I tell my patients to get a machine recommended by Hypertension Canada. There's a lot of technology out there, and we need to make sure as a patient you're using the right machine, so I as a doctor feel comfortable with it.
When I was choosing my blood pressure monitor, the factors that were important to me were, first of all, accuracy and, of course, ease of use. And it was also important to me that it had some sort of seal of approval so that I knew that I could rely on it. I think I would recommend having a blood pressure monitoring system to anyone who is being treated for high blood pressure and needs to just keep track of it. I think it's very helpful.
To find out more about women and heart disease, visit us at betterlivingtv.ca.